Dr. Molshri Mishra, and today I'm going to talk about high-risk pregnancy. So what makes a pregnancy high risk? Any pregnancy which multidisciplinary approach is very important for management of these patients. While any pregnancy can become high risk any time, but it is seen that if certain factors are present priorly or developed during pregnancy, then the pregnancy becomes high risk. So what are the factors? Extreme maternal age, that is age less than 17 years, age more than 35 years is a high risk. Anemia, any previous cesarean or previous uterine scar, BP, high sugars called as gestational diabetes, multiple gestation like twins, obesity, thyroid disorders, any bleeding during pregnancy. If it happens early in pregnancy, it is called as abortion, and if it happens late, it might be because of some placental issues, which makes it a high-risk pregnancy. Heart diseases, kidney disorders, they can be pregnancy achieved after infertility treatment, like nowadays IVF pregnancies are high-risk pregnancies. All autoimmune disorders lead to high-risk pregnancies. Pregnancy due to with a history of cervical incompetence, which will lead to there is a risk of preterm labor in this delivery, is a high-risk delivery. It is seen that about 15 to 20% of the deliveries are high risk, of pregnancies are high risk, and they are also increasing day by day in number. So what are the complications of such deliveries? The maternal complications can be increased risk of bleeding, increased risk of cesarean delivery, prematurity, high BP, increased need for ICU admission and blood transfusion. The fetal complications can be premature baby, the baby requires NICU or neonatal ICU admission, the need for respiratory support in the baby, more chances of infections and jaundice in the baby. So how do we take care of these high risk pregnancies? The best time to intervene is prenatally. I mean, preconceptional counseling is very important in these patients. So what we tell patients is to come to us before they are planning a pregnancy, and we need to make them pregnant in the best state. So how is that achieved? We suggest them lifestyle modifications so they have the best weight to have this. Then they need to eat healthy, have a healthy diet, have a healthy lifestyle. They should abstain from smoking and drinking. They should do all relevant investigations, and folic acid is started in them. Also, if there is any medical disorder in the patient, we intend to treat it, and for that we refer them to physicians and they optimize the state. Depending on the severity of the conditions, the pregnancies are monitored, and this management requires a good teamwork between all doctors, the gynecologist, pediatricians, fetal medicine physician. Their multidisciplinary approach is very important for management of these patients.